Hey everybody, welcome to this Caregiver Coffee. My name is Matthew Estrad. I'm a gerontologist in St. Tammany Parish, Louisiana, and I've been partnering with the Council on Aging in St. Tammany for over 10 years, as their caregiver support group facilitator. And for half of that time, I've been bringing you videos such as this for our Caregiver Coffee series. Today, we're going to be talking about aging and your eyes. So how our eyes change over time as we age, some of the conditions and diseases that it might get, and how to look out for them and what to do about them. So before we get into that, I want to plug our caregiver support group that has been going for those 10 years that I've been with Coast. We meet every Tuesday of the year unless there's a holiday, and even then we'll move it either before or after that. We typically won't cancel them. And the general pattern is the first Tuesday of the month is at the Slidell Activity Center on Cousin Street. The second Tuesday of the month we utilize the virtual platform Zoom, and you can join using your landline phone or smartphone. You can use the the Zoom app on the tablet or your smartphone, or you can join us on your computer, whatever you're most comfortable with. On the Tuesday, we're back in person, except we're at the Covington Senior Activity Center off of Highway 190. And then the fourth Tuesday of the month, we are back on Zoom. Now, some months of the year have a fifth Tuesday, and we usually play that by ear. If Coast gives us the thumbs up, we will meet. And if we do meet, it is on Zoom. So be aware of that. The best way to know exactly where we are and how to reach us is to get our bi-monthly flyer and calendar. So we refresh it every 2 months. And on it, you'll see the dates. You'll see any movement, like if we have to move from a Tuesday to a Monday or a Thursday, etc., because of a holiday. You'll see those types of changes and differences in pattern. So the way to get that flyer is to go to coastseniors.org and then go to caregiver services, and then you'll find a picture of me, and then there will be a link, and that the link will go to a PDF that you can download, save on your computer. You can print it, put it on your refrigerator. You can send it out to people. But that's how you get the flyer. And then, like I said, we refresh it every 2 months so it's accurate. Also on that flyer, there's a QR code and website that you can go to, scan or click on, and then that will allow you to join our private email list. And that just means on Tuesday mornings, you'll get an email reminder from me saying this is where we're going to be meeting, or we're on Zoom, etc. And also, when we have a new bi-monthly calendar come out, it gets sent to y'all as well. So I encourage you to do that. Now it is just it's just an email list for the support group. It's not it doesn't really advertise other Coast services. So just be aware of that. Although if there's like a caregiver expo or something else special that we want to direct your attention to and consider attending, we'll let you know via that. But it's not a lot of emails. It's basically one per week. So with that, let's get started with this. And so aging and the eyes, and this is based on an article at the National Institute on Aging, which is part of NIH. Like many of the videos that I do, they're based on an article, sometimes on a professional society or association, and this one is like most of them from the NIH. And what I'll do is, if this is your first video, welcome. I don't read the whole article, but I hit some highlights, some things I might read verbatim if they're important, but mainly I'm trying to deliver some element of education within 12 minutes, 12 to 15 minutes, but also pique your interest so that you'll feel moved to go to the article. And in the description of the video, we will have a link so then you can go to it and download it and print it and share it with others, whatever you want to do with it. You'll have more details and you'll get to digest it yourself. All right, so aging in your eyes. As we age, it's normal to notice changes in your vision. And a few changes for older adults might be losing the ability to see up close, having trouble distinguishing colors such as blue from black, and needing more time to adjust to changing levels of light. These can be easily corrected, so glasses, contacts, and improved lighting may help you maintain your lifestyle and be able to do all the things that you want to do. Your risk for some eye diseases and conditions does increase as you grow older, and some eye changes can be more serious than others. And keeping your eyes as healthy as possible is definitely started by getting an eye exam every year so you can catch any issues early. So what can you do to protect your vision? Well, just what I mentioned, an annual visit by an ophthalmologist or optometrist. Ophthalmologist being an MD, optometrist, still being able to examine the eyes and more related to eyeglasses. So they can help you protect your vision by detecting things, by detecting diseases, and letting you know so you can get them treated as soon as possible. Now, normal changes in the aging eye usually do not harm your vision. However, sometimes they can be signs of a more serious problem. For example, your eyes may leak tears, and this can happen with light, wind, or temperature changes. Sunglasses and eye drops may help, and sometimes leaking tears might be a symptom of dry eye or an infection or a blocked tear duct. And only your eye care professional can help you with these problems. Many people don't notice any changes or symptoms or signs in the early stages of eye diseases. So a dilated eye exam performed by an eye care professional is the only way to find some common eye diseases over time, and while they're easier to treat. You should do this every year, and everyone over 50 should have a dilated eye exam every year, even if you have good vision and you don't wear contacts or glasses. Now, after 60, you should get a dilated exam every year or two. Most people with diabetes or high blood pressure need to get a dilated exam at least once a year. So I know these are a lot of numbers and times, and that's why we share the article. During this exam, they'll put drops in your eyes. Many of y'all probably have this done before, just like I have. It widens and dilates your pupils so they can see inside of each eye better. Your vision will be blurry. It'll be sensitive to light, and it lasts a few hours. So this may mean that you do it earlier in the day and be prepared to stay there for a few hours, or you bring a friend with you so they can actually drive you home. If you wear glasses or contacts, you'll need to get your prescription checked too, in case that changes, because even small changes in sight can increase your risk of falls and injuries. You want to see your primary care provider to regularly check for things like diabetes and high blood pressure, and these diseases can cause eye problems if they are not controlled. So here are some tips for healthy eyes at any age. Protect your eyes by wearing sunglasses that block UV rays and or wearing a hat with a wide brim when you're outside. Stop smoking. Make smart food choices. And there's a hyperlink so you can go to the smart food choices that they're talking about. Be physically active and maintain a healthy weight. Maintain a normal blood pressure. Manage your diabetes if you have it. And if you spend a lot of time at the computer, like I do, or focus on one thing, take a break every 20 minutes to look about 20 feet away for about 20 seconds to prevent eye strain. So that is a good reminder for me. All right, so here are some of the eye diseases and conditions that could happen as we age. The following eye problems can lead to vision loss or blindness in older adults. They may have a few or no early symptoms, and regular eye exams that we talked about are your best protection in catching these. And we'll talk about, looks like 5 conditions. We'll talk about age-related macular degeneration, or AMD, diabetic retinopathy, cataracts, glaucoma, and dry eye. All right, so the first one, age-related macular degeneration. It can harm the sharp central vision needed to see objects clearly and to do common things like driving and reading. Your eye care professional will ask you if you have a family history of AMD during a dilated eye exam, and treatments are available, and special dietary supplements can help lower your risk if its risk of getting worse. Then there's diabetic retinopathy. This may occur if you have diabetes. It starts slowly and has often has no early warning signs. If you have diabetes, it's important especially to have that dilated eye exam once a year. Keeping your blood sugar and your blood pressure and your cholesterol under control can help prevent this disease or slow its progress in the early stages. Cataracts are cloudy areas in the eye's lens that cause blurred or hazy vision. Some cataracts stay small and don't change your eyesight much, and others become large and reduce vision. And cataract surgery is pretty normal and relatively safe and common treatment. Many people, maybe most people, will get cataracts. It's just a matter of at what age as you advance. Glaucoma is usually caused by too much fluid pressure inside the eye. If not treated, it could lead to vision loss or blindness. People with glaucoma often have no early symptoms or pain, and you can protect yourself by that dilated exam that we talked about, getting that every year. It can be treated with prescription eye drops, lasers, and surgery. Dry eye occurs when the tear glands don't work well. You may feel a stinging or burning, a sandy feeling like something is in the eye, or other discomfort. Dry eye is common as people get older, especially for women, and your eye care professional may recommend a home humidifier or air purifier, special drops, or ointments for dry eye. What is low vision? This is when you cannot fix your eyesight with glasses, contacts, medication, or surgery. And this affects some people as they age. You may have low vision if you can't see well enough to do your tasks, your everyday tasks, such as cooking or reading. If you have difficulty recognizing faces of family or friends. If you have trouble reading street signs, or you find that lights don't seem that bright. So as I read this, the symptoms, I think about, some of these might be mistaken for dementia, like not being able to do everyday tasks like reading or cooking. The second one, having difficulty recognizing faces of your friends or family. So that could, in certain circumstances, those could be interpreted as being part of your brain failing, or developing dementia. So this is why, if you start to have some of these symptoms and you're not readily thinking, oh, this is because of my eyesight, this is why it's important to go see your PCP, who can test you and figure this out and rule out other things, besides dementia. This and low vision being one of those. If you have any of these problems, you can ask your eye doctor to test you for low vision. Vision rehabilitation program and special aids, such as a magnifying device, can help you to adapt to vision loss and make the most of your remaining sight. There are also programs such as the National Library Service that link people who have low vision or visual disabilities to resources at no cost. Other tips that might help: bringing lighting into your room, writing with bold black felt tip markers, using paper with bold lines to help you write in a straight line. Install dark colored switches on the outlets so you can see them up against light colored walls. Use clocks with large numbers, with large phones with large screens, and large print labels on the microwave and stove. And this kind of reminds me of, and there's only one mention in this article, that we need more light as we age. So that would what I think about that is having a lighting professional come to your home to make an assessment and see about your light placement, the lighting types that you have, because the house was, even if you built the house and you helped to design it, you may have done it as a younger person, and now here you are, older, in the same house. Your eyes have changed. Your eyes need more light, but the home may not have changed. So it's probably a good idea to get a lighting professional to come in to measure, even measure what lighting you have and in what rooms, and figure out, okay, well, I do these things, do these tasks in this room, and this room is really just for TV, and this is, the kitchen, obviously you're cooking in there. but that can go a long way with helping you age in place and be able to do the tasks efficiently and safely. And speaking of safety, help prevent a fall in your home. So there's not like shadows and other areas that might hide things on the ground or, just be a trip hazard or a fall hazard. So I hope you consider all that kind of stuff in addition to what is discussed in this article. So as mentioned, we put the link to this article in the description, and I hope that is very helpful for you and your family as you age in place. So thank you for your attention for this Caregiver Coffee, and I hope that you will be seeing me again soon on a screen for the next Caregiver Coffee. Take care.